Brooklyn Ward. I recently graduated from the Master's of Science at Western University in Health and Rehabilitation Sciences. I worked in the Social Justice and Mental Health Research Lab, and my research focuses on the stigma of substance use for persons experiencing homelessness. Yeah, the first study I did was a scoping review to kind of collect information about the current literature that was out there related to stigma in relation to substance use for persons who experience homelessness or have recently experienced homelessness. And some of the main takeaways were a lot of stigma experienced by these individuals in healthcare settings. So many expressed feeling not trusting their healthcare providers, and in turn they avoid care until maybe their health deteriorates to a point where it's an emergency. So that was a common theme in that review. And then also public stigma, experiencing stigma from people on the street, individuals in their own communities, so some horizontal violence, experiencing stigma from other persons experiencing homelessness, other people who are using substances as well, experiencing a lot of stigma there, and that was a finding in that scoping review. Yeah, I think it definitely makes people not trust health services. They don't want to seek care that they maybe need. They might be in a place of ambivalence, let's say, related to their substance use. They're maybe thinking about wanting to stop or reduce or this type of thing, but they're not willing to talk to a healthcare professional about it because they've had so many bad experiences with healthcare professionals before. So it hinders individuals in that sense in progressing in the ways that they want to, or it can. And then in terms of the healthcare system, I think it puts more pressure on emergency services, and I think if there was less stigma, people would be more inclined to reach out for preventative care or early intervention care rather than waiting until something has progressed. And I think in the end it will cost, and it does cost the healthcare system more, rather than kind of addressing that stigma that maybe people aren't even doing on purpose and healthcare providers aren't doing on purpose, but it is happening, and it's maybe subconscious and something that I think should be addressed by those institutions. I think it's a lack of, and this came up in the study as well, it's a lack of understanding. For some people it can be difficult, I think, to empathize with people if they don't have shared experiences. And I think there's also a lack of interaction with individuals struggling with substance use and experiencing homelessness. Maybe healthcare providers haven't had much interaction with them other than in these, what you might call crisis situations in the healthcare system. And I think there's an underlying, a little bit of lack of empathy and understanding for the traumas and the background that many of these individuals have. But someone who is living in poverty and maybe grew up in poverty has never known anything other than poverty. They use substances as a way to cope, as a way to deal with harsh realities of living in the street, or the difficulties and the traumas they've experienced. And society doesn't view that as normal. Not only do they not come from a place of understanding, but really harsh judgment, really harsh kind of penalties, so to speak, in society for that. And I think it's definitely a class issue and a societal issue that needs to be acknowledged and addressed in terms of the disparities that exist between normalizing substances for CEOs, people who own homes, people who hold jobs versus people who grew up struggling or still struggle now. It is, yeah, I think it definitely is a class issue, and people who have more social privilege are excused more often than people who have less social privilege. And I don't think that that's something that it should be placed on the individual. It's really up to society as a whole and the people who govern our society to kind of invest the resources and find out why that's happening, and ask those individuals, for their input. Yeah, I personally do not think it's an ethically appropriate solution. First of all, I think people only do something when they, have the desire to do so, like when they themselves come to that problem. Some people don't want to stop using substances, and I personally don't think it's up to any of us to decide what other people do. I can't force anyone in my life not to go to LCBO of age and buy alcohol. I don't think we should be able to govern people's lives that we don't get to decide what other people do with their lives. So I don't think forced treatment is a viable or ethical solution. I think safe supply and giving people the right resources if they want to continue to use substances would be a better route, and just supporting them with they're at, asking them questions about where they're at, and kind of tailoring social and healthcare services to meet their needs rather than enforcing them to do something that, if they're uninterested in, probably won't stick past the treatment portion, and would just be kind of a waste of funding that could be maybe better allocated to other social services.